Cancer treatments can cause changes in sexual desire and function. And in this next video, we talked to patient Malcolm Norton and his wife Layla about their journey. We also talked to medical oncologist Dr. Fritha Hanning about some of the issues that her patients might face, and CEO of Prostate Cancer Foundation Graeme Woodside about the support his organisation provides men.
When men are diagnosed with prostate cancer, they quite quickly become aware of the issues that they may face in terms of the negative side effects that come out of their treatment. And so erectile dysfunction and incontinence just tend to come with that territory. Prostate cancer is effectively a couple's disease, and while the man has it, it still does affect the partner and those people around them. A man's maleness, if you like, is really linked to their sexuality. And for many guys, they are concerned that they won't be the same again, and that's the reality of it. At least for the short term, or the short to medium term while they're having their treatment, they may not be able to be sexually active, and they may have to deal with incontinence. But for some guys, well, they say, at least I'm alive, I can live with those other things.
In terms of sexuality changes with hormone therapy, one of the things that happens when you start a hormone therapy for prostate cancer is that it does lower the male hormone testosterone. And that testosterone is an important part of our libido, of how we feel in terms of that desire to have sex, and so that can change. And for some people that's really key, and for others it's not as important. And so it's about thinking about how important is that for you personally and in your relationship. There can be these changes in sexual function and changes in intimacy, and I think that's just working together as a couple to decide what's important.
So the physical thing was never quite the same, but for me, the cancer has definitely affected my ability to the erectile dysfunction aspect. So from a personal point of view, yes, looking back, it'd be really nice to be able to still be able to do that. However, life goes on, and I think I'm a fairly pragmatic sort of guy, and I'm just so thankful that I don't have the other major issues. Now the cancer's under control, and I don't have any incontinence issues. It's not good for a guy not being able to deal with having to deal with erectile dysfunction, and it's probably easier the age that I am. I'm sure that for somebody who's much younger, it would be really, really difficult.
For me, to deal with the lack of the physical side of your relationship, I basically just put that part of my life in a box and just nail the lid shut. The thing that's really important is that you're still here, and that we can still start our journey together, and not everyone gets that opportunity.
In some respects, we're probably closer now than we were prior. That's from my perspective.
Some of the hormone treatments that are used to treat prostate cancer, they can cause side effects. So people can have the impact of hot flushes. Sometimes they can find that they maybe have a tendency to gain weight. So it's, in a way, having hormone therapy for prostate cancer is a little bit like a male menopause. And quite often wives are saying, well, I know exactly what you're going through because I've been there too. And that change in your hormones, often as you go through the change when you're first starting the treatment, the symptoms and side effects can be worse than they're going to be once you get through that change. There's
a lot of frustrations. I mean, one of my frustrations is with some of the side effects from the hormone treatment, and that sometimes you're just not quite as resilient, and sometimes the hot flashes and things are probably the worst. But however, you just have to learn to deal with that, because that's the new normal.
The Prostate Cancer Foundation is there to support men and their partners and their families going through prostate cancer diagnosis and treatment, both of which can be pretty challenging. And we're really about four things. The first one is awareness, and so we do quite a lot out there in the community, making guys aware of prostate cancer and getting checked. We provide support to patients and their carers. We fund some research. And we also do quite a bit now in advocacy, trying to get better treatments, better diagnosis, better medications, and intervening when patients have problems getting their treatment.